Hey, what's up everybody? Dr. Rossi. I feel like now is the perfect time to give a quick discussion on didactics in residency training, since I happen to be getting ready for my didactics today, so I can talk a little bit about the structure of the didactic day, what goes into it, and some of the potential differences from program to program. So let's go ahead and crack right into this discussion about didactics. So didactics can be done a couple of different ways depending on your residency. At my particular program, it's done for a full day, generally once per week. So one of my days, in my case Tuesday, the entire day is devoted towards didactic training. Now, what do these didactics consist of? Generally, they consist of a bunch of different lectures, essentially, one of which is a grand rounds presentation usually. So let's start with the grand rounds presentation, because that's usually the first lecture, or maybe the most important lecture, because what they do at most programs, including mine, is they'll bring in a lecturer who has an area of expertise in some area of psychiatry or some area of medicine related to psychiatry, and they'll come in and they'll give a talk on that area of expertise. So you are literally getting an expert in the field. An example might be Donna Sudak, who is a very, very good cognitive behavioral therapist, maybe one of the best in the country, and she came in and gave us a didactics and a very interactive grand rounds discussion on cognitive behavioral therapy, how to implement it into daily practice, and how to really get started with cognitive behavioral therapy as a trainee. So that was a good grand rounds that I could think of. But we have other examples of people from various fields. You have people sometimes from hematology and oncology give a lecture about depression and cancer. You have people come from OB-GYN and give a discussion about psychiatric medications in pregnancy, right? So there's a lot of different ways that the grand rounds can be structured, but again, generally, it's somebody with expertise in a particular field who's going to come and talk about their area of research or expertise. The rest of the didactics day will really depend kind of on what your PGY year is and how your program structures it. So in my program, we actually separate people who are in first and second year and third and fourth year. So the first and second year residents will kind of have the same didactics. A lot of times there's a lot of overlap between first year and second year. So it can get a little bit boring for an advanced second year to re-listen to many of the same lectures that were given to the first years. And those are usually the bread and butter kind of topics of psychiatry. So they're going to go through your DSM diagnosis. So basically they'll take I'll put it this way, at least in my program. We'll take a topic like depression and we'll go through the whole thing from start to finish. So it will be DSM diagnosis, how to make the diagnosis, what the criteria are, etc. It will then go into some of the biological factors associated with depression and etiology of depression. We'll then go through epidemiology of depression, so we'll look at all the statistics, what's the prevalence, right, of depression in the United States, and what are the remission rates, etc. Then you'll look at treatments, and you'll kind of divide that up into the psychotherapy-based treatments like CBT or interpersonal therapy for depression, and then the psychopharmacology aspect, and you'll look at all the antidepressant medications and different ways of treating depression that way. Now, with things like depression, you may also talk about neuromodulation, things like ECT, TMS, etc. So they'll kind of break down the entire topic of depression as one of, say, the lectures for that day. And this is usually divided up into several lectures, because you're probably not going to be able to cover, very dense topics like depression in a single 45-minute to 1 hour lecture. But that will be a typical example of the way PGY 1 and 2 didactic day will go and the types of lectures that they'll have. Now for 3 and 4, they do more advanced topics, and probably the big difference I can see in 3 and 4 is that it's less of the focus on the biological stuff, and there's a lot more focus on psychological treatments. So there'll be a lot more discussion about CBT and psychodynamic psychotherapy and different ways of implementing those things. So we've had psychodynamic lecture series where we went from kind of start to finish through psychoanalytic theory and then on to implementation of psychodynamic psychotherapy in practice. And the same goes for CBT. Did a very thorough lecture series on CBT, how to use CBT What are the same thing as I described it for the PGY 1s and 2s. So what you would do is you'll say, okay, well, what is CBT? So we'll clearly define it. We'll explain what the relevance of it is and what the research indicates about its usefulness in various disorders, and we'll go through a lot of those kind of things, looking at some of the pivotal studies that indicate CBT was a good therapy modality. And then you will look at the practical aspects of how to implement the techniques into day-to-day practice. And that's sort of the way the didactics will be structured. Now, with your didactics being once per week and having an entire day of didactics, that can be quite exhausting, in my personal opinion. I don't necessarily get much out of lectures anyway. I much prefer to pick up the textbook and read it and then apply it in my cases. So lectures for me are not very helpful, and again, it can be a long day if you're having like 8 hours or 7 hours of lecture back to back. So you can get pretty exhausting, and the amount of information that you're going to be able to retain or cram into your brain during that period of time might be a little limited. So generally speaking, grand rounds in the morning. After the grand rounds, you'll likely split into groups, PGY 1s and 2s together, 3s and 4s together, and then you'll go through your lecture series throughout the day, and that will usually consist of like a small lunch break after the grand rounds, and then probably something like 4 additional lectures after that on various topics. And again, the topics are kind of chunked into different blocks, so it depends on what you're looking at. So you might have a block of psychodynamic psychotherapy, you might have a block of CBT, and the next, like say 4-week block, you'll have CBT. And for PGY 1s and 2s, it might be a block on depression, and then a block on schizophrenia and other psychotic disorders, and then on bipolar disorder, etc. So it'll kind of be chunked in that manner, and you will have that type of a structure throughout the day. The one benefit of COVID is that we can't cram everybody into these little conference rooms anymore, so now we get to do these things virtually. So it's a huge benefit, for me to be doing my didactics from home versus doing my didactics on site, which was a much longer drive and much more logistics went into getting prepared for that day. So hopefully this brief video on didactics is helpful. If you guys have other questions about the didactic structure, specific topics, I'd be happy to elaborate on them and comment below. Thanks.